The following presentation will go over the basics of stroke-related vision deficits, presented by Molly Hosking, occupational therapy student from Spalding University. When an individual has a stroke, their brain stops the process of bringing blood and oxygen to the brain cells for nutrients, which can cause damage and death of the cells. In relation to vision, it can affect parts of the brain that are in charge of visual skills, which can include memory, reading, balance, depth perception, eye movements, and visual fields. There are several different types of vision deficits related from stroke that can include the following. Henominous hemianopia is a loss of vision in the right or left half of the visual field in each eye. Quadrantenopia is the loss of a quarter of the visual field in each eye. A scotoma is a blind spot found in one or both eyes. Neglect or spatial inattention is when people do not respond to or aren't aware of things on their stroke-affected side. This problem isn't related to vision necessarily, but results from damage to the parts of the brain that receive visual information. Eye movement disorders can occur when the nerves or muscles that make your eyes move are damaged from the stroke. These movements include rhythmic eye movements called nystagmus, misaligned eyes, eye tracking control issues, often known as oculomotor dysfunction, and double vision. Dry eyes can also occur when some have trouble blinking or fully closing their eyes, and their eyes don't stay moist enough. When this happens, dry eyes can develop, causing irritation, burning, or blurry vision. Now, just to note, most people who experience this vision loss will not fully regain it, but some may experience vision recovery within the first 3 to 6 months. We will now be going over the anatomy for vision-related deficits from stroke. Within the brain, there is 4 lobes. One of these lobes is called the occipital lobe. This is the area of the brain where most of the processing of visual information occurs. The brainstem is located at the base of the brain that controls eye movements, sensations related to balance and stability, and your ability to recognize and understand objects. Now with this, there are 2 streams within the brain that relate to visual information being processed. One stream is called the dorsal stream. This is the where system that controls attention and spatial perception. The superior route of this stream carries visual information from the occipital lobe to the prefrontal cortex. The ventral stream is the what system that controls face, object, and word recognition. It is the inferior route that carries visual information from the occipital lobe to the prefrontal cortex. The visual pathway within the brain is from the front of the brain to the back and is made up of the eye, the optic nerve, the optic chiasm, the optic tract, lateral geniculate, and the visual cortex found in the occipital lobe. From where the damage of the stroke occurs in the visual pathway, it affects how one's vision is impacted. To diagnose vision-related deficits from a stroke, either a neurologist, ophthalmologist, optometrist, neuro-ophthalmologist, or neuro-optometrist can diagnose those with vision loss. According to the American Stroke Association, roughly 65% of stroke survivors experience these vision deficits. Effects from stroke-related vision deficits often include scotomas or the blind spots in various locations depending on where the damage has occurred, visual field deficits, and unaware of surroundings on a specific side of the body related to visual inattention. Treatment and management strategies for vision-related stroke deficits can include the following: of visual skills of tracking, scanning, and tracing, adjustment of lighting, creating anchors for reading, shifting items to a certain direction to improve attention to the neglected side, use of magnification, use of prisms and glasses for expanding visual fields, learning non-visual aids and skills depending on the severity and progression of the effects with assistance from low vision rehabilitation. Visit www.kylionsi.org/low vision resources for more information regarding low vision resources for you or your loved one.